Hi there. This recording is for parents who just got the diagnosis that their baby has spina bifida. We know this is a really stressful and overwhelming time, and we are here to try to help. We hope that your medical providers are giving you all the information that you need about spina bifida, treatment options, and care for your baby. And we're here to give a little parent to parent information and tips. I'm Colleen Payne. I am SBA's Expectant and New Parent Resource Coordinator, and I have a son with spina bifida.
I'm Jessica. I am a diagnosis support volunteer with SBA, and I also have a son with spina bifida who is 6 years old.
So, together, the two of us have a combined 25 years of experience with walking alongside newly diagnosed parents. And so, we see a lot of questions, and we are here to answer some of those frequently asked questions. First, I want you to know about some resources that SBA has for you. You can go to spinabifidassociation.org and go to the Expectant Parents page. There we have guides that are digital and also printable resources that talk about spina bifida treatments and daily care. And we continue to add more to that. You can also find out about local chapters, national events, and online communities where you can get connected and learn more. And we also have an expectant parent mentor program where you can fill out a form and we will match you with a parent who has been trained to be a mentor, and they can offer you support and guidance as you move through the next few months.
Okay, so we're going to jump into some fun stuff. Um, what it's like to make a baby registry for your baby with spina bifida. It may look a little bit different, but a lot of this stuff is already familiar to you. So we're going to jump into some diapering essentials. You want to look for some products that are catered to sensitive skin because spina bifida babies are sometimes known to have sensitive skin. And also, you'll learn that babies with spina bifida also require latex precautionary items, such as latex free diapers. A lot of our moms are always bragging about the Huggy Special Deliveries or the Pampers Pure because they are listed right on the box as latex free. And then when we're talking about sensitive skin, the babies with spina bifida, you want to get into how to treat diaper rash. And if it occurs, what products that you're going to use. For me and a lot of the other moms, we really love the Como Espadine ointment for moisture protection and a good stoma powder as well. Okay, so this is your play and development section. When you're getting into the toy aisle and what you want to pick up for your new baby. Everybody loves toys, so I'm sure you've seen the little teethers in the aisle. You'll want to definitely make sure on the package that it is listed as silicone or latex free. Um, something is the little niblets carrot teether right on the box. It does say silicone base, so that is super easy. And then we also want to get into some tummy time stuff. A lot of babies with spina bifida need to grow stronger, and that's just your regular typical babies. I give some interactive play and some bonding time with mom as well, and it lets you engage with your baby when they're doing some therapy. A lot of the moms really like the VTech Tummy Time Discovery Pillow. Um, any baby is going to love to use those products, and the babies with spina bifida as well. Okay. So this is for the larger must-haves. A lot of these products are highly recommended in our online support groups. We've seen the names of these items over and over again that parents really like. Um, one of them is the Owlet Smart Sock. I know that you guys have probably seen that advertised before. It really just gives a peace of mind to mom to have that, notification on the smartphone that their baby is doing good while they're sleeping. Um, but keep in mind, if your baby does come home in boots and bar or a cast for club foot, this item probably wouldn't be best for them. And then also, we want to highlight the baby carriers. Um, the Ergo Baby 360 has fantastic hip support that babies with spina bifida really need. It's recommended by moms and also by the orthopedic physicians as well. Okay, clothing options for our cute little babies. You want to, if the baby is going to be in the NICU, that's something that you won't know. So you really want to go with something that's going to be easy to undress baby. Um, Something with side snaps, footless sleepers, especially if baby is going to have possibly boots and bar or club foot or cast or anything like that. So something that's easy and just overall cute and essential. Nothing too crazy.
So Jess mentioned the NICU. This is the neonatal intensive care unit, and most babies with spina bifida spend a little time in the NICU at least, because when they're born, they get the VIP treatment from all of the specialists. And so this is an exciting time because it's when you first meet your new baby, and finally see what all the fuss has been about for all these months. But it's also really stressful because there's just a flurry of activity those first few hours, days, and weeks. And it doesn't help that moms typically have a lot of hormones surging at the same time. It really, really does not help. So be easy on yourself. Um, the average NICU stay, they say, is about 2 weeks. It varies so wildly. Jess's son spent zero time in the NICU. My son spent 3 weeks in the NICU. And it really just depends on their health when they're born and what issues that they're having, if any. So, to prepare a little better for the NICU, you can ask to take a tour in advance, or you can just ask the staff for some information. You're going to want to know about what are the visiting hours, who's allowed to visit, are siblings allowed to visit, are children allowed there. You're going to ask about pumping breast milk, and your options there if they have hospital grade pumps for you to use. And then if you live far away, it's going to be hard for you to leave at night, go home and sleep and come back. And so you can ask about any parent accommodations such as the Ronald McDonald House. You really don't need to pack a whole lot for your baby because the hospital provides everything that they need. And most babies just wear a diaper for most of their stay because they're in a nice, warm isolette. And it's just easier to keep track of their monitors and things when they just have on a diaper. But you can bring personal items to make it feel more like home, pictures, little blankies, things like that. Just write your name on everything and make sure it's not something that's irreplaceable because things do get sent to laundry and whatever else. So all you really need is toward the end, you need a coming home outfit, the cuter the better, and an approved car seat. So what does this look like? So there's two options for treatment for spina bifida. One is to have surgery after the baby's born, and one is to have surgery before the baby's born. So the after the baby's born is postnatal surgery. And so a lot of parents ask, am I going to be able to hold my baby as soon as they're born? This is really important, something we get a little anxious about. So when a baby is going to have postnatal surgery, sometimes they can be wrapped so that the opening on their back is covered and safe. And sometimes you can hold your baby then. Surgery usually takes place in the first 24 to 48 hours. And then after surgery, the back is healing and they want to keep the baby pretty flat, but often you can hold the baby on your lap, either on their tummy or on their side, and a nurse can help you do this. For fetal surgery, they're going to look and make sure the surgery site is all closed up when the baby's born. But a lot of babies who have fetal surgery are born premature, and so they might need some other help with breathing and feeding and such. So a nurse, again, can help you with kangaroo care and with holding and feeding and all that. When my son was born, I saw him. I had a C-section. They held him up over the curtain for me to see, and I could see how beautiful he was and introduced myself to him. Then they whisked him off to the NICU to assess him, and Dad got to go with him, take pictures to send me. He got to change the baby's first diaper, all that sort of thing. And then when my epidural wore off and I was able to get myself into a wheelchair, then I could go visit in the NICU. And I remember very clearly he was fussing. And as soon as the nurse laid him in my arms, he quieted. And it was magical. And so I know this is a stressful thing, but I just want you to know that whenever you hold your baby, whether it's right from the beginning or if it's longer than you would like to wait, it's still that magic of holding your baby for the first time. So in the NICU, one of the most confusing things for me was this whole parade of doctors, nurses, nurse practitioners coming in and out of the room. And I had a hard time figuring out who to ask which questions. So you can screenshot this and any of the other slides. You're going to see a neonatologist, and they focus on like newborn care. These are the newborn and preemie specialists. Then you'll have neurosurgery, who you might have already met. They're the ones who handle all of the neurological stuff, anything to do with the nerves and the brain. Then there'll be a urologist who is carefully monitoring your baby's bladder and kidneys, making sure they stay very healthy. Orthopedics deals with clubbed feet, which is a condition that can sometimes happen with spina bifida, and anything to do with the bones, the joints, and the muscles. There will be NICU nurses there at all times, and they can show you how to do your baby's daily care and help you with that so you feel comfortable when you go home. And also remember that you are just as important as every other person on the medical team. You're your baby's voice in this situation. So ask questions. If you don't understand, keep asking until it makes sense to you. And you voice your opinion until your child is able to do it for themselves. Another question we get a lot is, will I be able to breastfeed my baby? Yes, in general, yes. So breast milk is encouraged. It's great for its antibodies and for baby's digestion. So specifically with spina bifida, it's good for those two things. Most moms begin by pumping in the hospital the colostrum in their milk, and then that is fed to the baby via either a tube or a bottle. And then as the baby gets a little bit bigger and stronger, then a lactation consultant or a nurse can help you practice nursing. If you go with formula, there are some formulas that are easier on the tummy than others. So things that have extra added iron, fiber, things like that might be hard on the tummy. And so you're going to want to talk to the pediatrician about a gentle formula. Also, while in the NICU, it's important to go ahead and apply for resources and assistance. It's good to do this while in the NICU because you're there, and there is usually a social worker who's able to help you with these things. So the first one is early intervention. Every state has an early intervention program, and it provides therapies and other supports for babies who have either delays or disabilities, and really for their whole family. And so your hospital social worker can refer you, the pediatrician can refer you, or if that doesn't happen, you can just call them up and refer yourself. And I highly recommend getting this started basically as soon as you get home from the hospital. Usually they start around 6 weeks at the earliest. These therapies are wonderful. It helps you bond with your baby and it gets your baby strong and helps them reach their potential. So don't think of therapies as something your baby has to have if they're showing delays. This is something to keep your baby on track. And so it's more preventative care. You can also apply for SSI and Medicaid. So I know there's a lot of letters out there, SSDI, Medicare. There are a lot of programs, but these are the two that you're going to be focused on. SSI is like monthly payments to provide a basic income for people with disabilities who have low income. And so you apply for that through the Social Security office or online. And then Medicaid is health insurance for people who have disabilities and or are low income. So you can apply for that through your state's Department of Health and Human Services. So again, ask your social worker for help with this. Even if you think you don't qualify for it, it's good to apply for it anyway.
So, another frequently asked question is, can my baby go to a typical daycare facility once mom and dad go back to work? Because we all know that we need to go back to work a lot of the time. So, the answer to that is you won't know if your baby qualifies to go to a traditional daycare until baby is here and home. Um, a lot of the time, if your baby does not require any specialized nursing care, such as cathing or anything like that, your baby may qualify for a traditional daycare. If your baby comes home and requires any type of complex care like cathing or anything like that, they may qualify for something that we call a PPAC. It's a prescribed pediatric extended care facility, and it's basically like a medical daycare for children and babies that require any type of nursing needs, such as therapy, cathing, medications, or anything like that. Um, Another option that we really like to talk about in our support groups is um, in home private facilities and in home babysitters or even family. A lot of parents that we see that have their newborns and need to go back to work right away really like to fall back on that third option of having an in home um, babysitting option.
So when you get home with your baby, those first few months, there's going to be a lot of appointments, and these are really important. So these first appointments will include your pediatrician. Even though your baby's going to have a whole bunch of doctors that we've already talked about, they still need that pediatrician to make sure they're gaining weight well, to give them their immunizations, to deal with ear infections as they show up, just all the typical child things. Your pediatrician doesn't need to be an expert in spina bifida. You just want to find somebody that you communicate well with and you have a trusting relationship, and they can be a real help when trying to when getting referrals or deciding what to do about a certain issue. Um, you're going to see neurosurgery in the beginning in those first few months. They're going to really monitor for hydrocephalus and whether there needs to be treatment for that, and to make sure that the back is healing well. Urology is going to keep a really close eye on the bladder and kidneys. It's important, especially that first year, to keep a close eye on this to keep everything healthy. Um, Especially babies who have clubbed feet will see ortho from the beginning, and then of course throughout the rest of their childhood. And you may also see GI and have therapy evaluations. These appointments are frequent in the beginning, but they tend to lessen as time goes on and the baby gets older. It's also really important for a mom to make sure she's getting her postnatal care. She's healing well from if she had to have surgery, like a C-section, and if she is having postpartum depression. Just you can't take care of your baby well if you're not in top condition, and so we really encourage mom to get that follow-up care as well.
So, all the specialists that Colleen just listed may seem overwhelming because there are so many of them. I know I struggled with that in the beginning because I'm also a career mom as well. So, trying to struggle scheduling all those appointments to fit within 2 weeks or a month was really overwhelming for me. I did find comfort in something called a spina bifida clinic. It's basically coordinated care through a hospital that allows you to see all those specialists that we just listed all in one day. So, and all of those doctors all specialize in spina bifida. So, you know that you're going to see somebody who is familiar with what your baby is going through, and they can also just help you coordinate everything, and everything is just so seamless and all in one stop. It really helped me put my mind at ease. And to find a list of the spina bifida clinics at a hospital, SBA has one right on their website, and it's state by state, and they have every single one listed for you. It's really helpful.
So a lot of people ask, what do I need to know about these first visits? What do I need to ask? And here's what we think is probably most important. When you see each of these specialists, the main thing is you want to feel comfortable and confident with what symptoms am I looking for, whether it's for hydrocephalus, for UTIs, or different issues. What symptoms am I looking for? And if those happen, what do I do? Because kids always get sick or something happens on a Friday at midnight. So, does neurosurgery want you to go to the local ER? In certain situations, do they want you to call the on-call doctor? Do they want you to send a my chart message? Do they want you to come in the next office hours? And this really depends on both the issue as well as the provider preference. So just get a good idea of what you can expect, how to communicate with the doctors, and what you're looking for. Of course, take notes, bring lots of snacks and diapers. Sometimes you got to wait on those doctors. That's how it goes. And these can be long days, but it's nice to have everybody in one place.
Okay, so as we wrap up the end of our presentation, we just want to remind you that community is really important for mom and dad, and it's also important for baby as they grow. We just want to remind you that SBA holds events and a meet and greets for all families that have children with spina bifida and allows connection. We also have a really large online SB support community as well. And that's where a lot of us met. And it's really important for to build those relationships and really important for baby to build those relationships as well and to just find their people. And I just want to say that SBA and all of our friends and everybody that we have met along the way have been absolutely fantastic. And I'm very grateful for them. So I just want to remind you that we have those support systems here for you.
And just keep in mind, remember, take care of yourself so you can take the best care of your baby. You've got this, and you aren't alone.